Okay, so we are live. So hello to all the viewers. This is a very special session, and I've got a bunch of students here. And basically, this is uh, a session with the toppers of Final MBBS, KUHS. That is so we are live. So hello to all the viewers. This is a very special session, and bunch of students here, and basically this is a session. There is a session with the of Final MBBS, KUHS. That is so we are live. Yeah, all right. So it was at my end, I think. Okay, right. So hello to all the viewers. This is an interview session with the toppers of KUHS Final MBBS exam. So rank 1 across most of the medical colleges across Kerala has joined us. And in this session, they'll be sharing some important tips and tricks for preparing for the final MBBS theory and practical exam. So the viewers will be students of the junior batch, that is the 2019 batch. So all these toppers will be giving us some insights into how they prepared for their theory and practical examination. So first of all, hearty congratulations and welcome everyone. Securing rank 1 in your college, it must be a proud feeling, and more than that, having that prefix doctor to your name is again a wonderful feeling. So on behalf of team DocTutorials, I'm welcoming all dear students. Okay, right. So let me just tell all the viewers that see, in this session, which is going to be a discussion of the frequently asked queries of final year MBBS students. Remember that this session is to give you a guidance. All the toppers might not have prepared in the same way. You will have differences in the mode of preparation. So it's okay to understand that toppers do not study the same way. But what you have got to do as a final MBBS student is listen to them and you try to find out for yourself which is the best strategy according to you, or what strategy best suits you, and you can proceed ahead with that. Okay, right. So that is what I want to tell all dear students to start off with. So first of all, let me just start with Adira from Calicut Medical College. Can you please unmute?
Sir, I can hear you.
So, right. So Adira, first of all, hearty congratulations and welcome.
Thank you, sir.
And Adira, I suppose you are rank 1 in KUH, right?
No, sir, I'm not sure, sir.
You're not sure. Okay, but from the marks I got, it seems that you got the highest marks. Okay, right. Adira, so I'll start with the practical part. Okay, you've got the theory part, the practical part. So I start with the practicals because many students are finding practical exams more difficult. So Adira, just tell us one thing. Like when you prepare for a practical exam, my question for you is, many students find writing the case sheet properly very difficult, because when you want to present a case for your final MBBS practical exam, the way you write the case sheet is very, very important. So can you just tell us some tips on how you practiced writing this case sheet and how that helped you for the practical exam?
Sir, first of all, I took a list of long and short cases from my seniors, as well as some practical manuals. Then I prepared a list of cases. Then I started making a case format for that, so that we will not miss any negative history and positive findings also. Then we have to practice taking cases in the ward. Then we have to make a list of differential diagnosis for it, and all the common differential diagnosis we have to practice it daily, and we have to write the entire details of that diagnosis so that we can revise it frequently.
So Adira, basically what you're trying to say is that you used a word, you have got to practice.
Yes.
So Adira, how important is taking cases? Do you think taking multiple cases helped you?
Yes, sir. We have to take multiple cases. Then only in the exam we'll get a general idea of what the cases. Otherwise, exam within 45 minutes we will not be able to arrive at a differential diagnosis if you are not practiced in taking cases.
So, and also you have got to be very thorough with the case format also, correct?
Yes, sir. Otherwise, we'll miss some of the important points.
So, for the dear students watching this, the summary of that question is, for writing a case sheet effectively, number one, you've got to be thorough in history taking. And how do you do that? Yes, you have got to read the theory part of it, but it's very important to take multiple cases. Second, it's very important to know the proper examination format. And as Dr. Adira said, you have got to just go through it again and again, because in the exam, you cannot think too much. You've got to be very, very thorough with the case taking format. And number three, take multiple cases, which is definitely going to help you. Okay, so this is the summary of, I think, the points that Adira wanted to convey. Now, that is the first question regarding the practical aspects. Okay, now, second is, do I have Dr. Dr. Khadija? Yeah, can you please unmute? Khadija, can you please unmute? You are muted, Khadija.
Yes, sir. Good evening, sir.
Good evening. So, Khadija, my question to you is, Khadija, I asked Adira regarding approach to cases in final MBBS practical exams. Khadija, many students find writing a proper diagnosis difficult for the practical exams. And many a times also they find it difficult when the examiner suddenly asks them, okay, you tell the case summary. Okay, you might have prepared the case sheet, but suddenly they ask you to summarize the case. So my question to you is, for long cases in practicals, what is your advice for the juniors on how to write a proper diagnosis?
Yes, sir. Thank you, sir. First of all, I have to first point is regarding an approach to writing a diagnosis is write the complete diagnosis is very important. As we all know, from first year, second year, we just write as a diagnosis as simple words, just COPD or CLD. When we came to the final year, that's not a proper format for writing a diagnosis. So I mean the complete diagnosis. I will explain this with some few examples. So for all system, you have to write a functional diagnosis, anatomical diagnosis, pathological diagnosis, and etiological diagnosis. So the most common essays frequently asked is the CVA stroke. So for example, functional diagnosis, we have to write the current situation of that patient right now. So for example, the right-sided hemiplegia or paraplegia, and if there is any cranial nerve involvement, for example, right side facial palsy due to acute CVA. And next we have to write the etiology, whether it is thrombotic or embolic. And then we have to write next an anatomical diagnosis, that is a site of the lesion, whether it is dense hemiplegia that is affecting the internal capsule, or the loss of consciousness and altered sensorium or seizures are there in the history. Then anatomical diagnosis is cortical lesions. Then next we have possibly write which artery is involved. And then next we have to write whether the patient is recovering or not, functionally recovered, the phase of recovery. What is the stage of the recovery of the patient, whether the stage of neuronal shock or whether the patient is in neuronal shock. Then similarly, we came to the chronic liver disease, whether we have to write the complete diagnosis, we should write the compensated or decompensated, and we have to write the complications. Then in COPD, acute, whether simply writing the acute exacerbation of COPD, we won't get full marks, the 2 marks. Okay, and we have to write acute exacerbation of COPD. It is secondary to LRTI or URTI, and probably the etiology could be smoking or occupational history of pneumoconiosis. Whether there is any complication, that is with or without evidence of type 1 or type 2 respiratory failure or core pulmonale. As such, this is the way of approaching a diagnosis. Without even completely reading a essay, we won't rush to a diagnosis. That is the second point I want to mention.
Basically, Khadija, what you're trying to say is that even for your practical case, as well as the long case in your theory exam, in fact, your essay in your theory exam, which is going to be a clinical scenario,
yes,
when asking about diagnosis, the point you emphasized is the completeness. It should be a complete one. So rather than just writing stroke, just writing myocardial infarction, just writing infective endocarditis, just writing chronic liver disease, there has to be a completeness. If it is for neurology, you have got to bring the functional deficit, the anatomical side, finally the etiology. Then there are any complications like urinary tract infection occurring in a patient with a stroke or a aspiration pneumonia or a bed sore, and then comorbidities like diabetes, hypertension. So she is stressing about the completeness, which applies to both the practical case as well as the essay. Any other point regarding this?
It's a in theory aspect also, we should prepare about what we are going to write in the next seconds. That is, on our first few minutes, we have to prepare for the first questions also, and for the last 2 marks questions also. We should prepare some points, because that is the most anxious time where we are facing. So I want to stress that point.
Basically, what you're saying is, when an exam, in the exam, for the essay question, after the diagnosis, for the remaining questions also, you have got to frame your answer properly. Yes, we'll be discussing that point also in detail in the subsequent questions. So thank you for that input, Khadija, regarding the complete diagnosis part. I think this is something every student should know. Okay. Now, second is, next point, I'll come to Dr. Leah. Leah, are you there? Leah K. Sunny from ILP Medical College.
Yes, sir.
Yeah. Leah, Leah, my question to you is, final year MBBS is very vast, and many students have difficulty in the approach. So I'll give you 2 approaches, and you just tell me, what did you follow, or was it again a third approach? So when you wanted to learn, say, medicine, did you go for a textbook or an app, whatever it is? That first, you finish that, and then come to previous year questions? Or did you first have a look at the previous year questions and then study those questions and related areas from the textbook or app? What approach would you suggest?
Yeah. First of all, thank you for giving this opportunity, sir. So basically what I did was, once we finished the clinical postings for a day, I used to come back and read the like the theory part related to that case which I took on that current day. And like if the case was a COPD one, I used to read the respiratory system. And as far as exams were concerned, once the sessional exam was announced, I would initially, the first preference was always for the previous year question papers. So first of all, I would go through the previous year question papers which were asked from those relevant topics. Then if there was time, like the selection book which I followed was Collateral. and like I would go through that selection topics which is given, because covering everything from each and every chapter of Davidson it is not that easy. It's very difficult. So once you are not organized, it will be a very difficult task. Suggestion would be first preference should be given to the university, previous year university question papers, then later on the other selection topics, and then if you have time, go on reading the boxes, because the most of the questions are asked from the boxes in Davidson. So going through each and every box would be helpful if you want to score more marks. That would really be beneficial.
Now, let me just put the same question to Dr. Shreya as well, just to see if she has a difference of opinion or she prepared in the same way. Shreya?
Thank you, sir. Thank you for giving this opportunity. So actually, I studied with the text first, then I went to look the previous year questions. So because for me, I just want to build the concept clearly. Then I used to go for the selection book, and I used to look which all questions, and then I practice. But once we read, suppose cardiology, I used to read the whole, like Davidson, the whole chapter. So we'll get even the short notes from that, because short notes can come even from a fresh topic. So that actually helped me for the exam when it came to the short notes part. So reading textbook and then looking into the previous year question, that's how I followed.
Right. So you can see, even toppers are actually slightly differing in the way they prepare. And if you ask me the same question, my suggestion would be, my way of preparation was I'll first look at the previous year questions. It's only to get an idea. But I totally agree with Shreya that you've got to understand the topic. But why I went to the previous year questions first is I wanted to know what topics are important and what topics are frequently asked. Now, when I study cardiovascular system and I see that, okay, the treatment of infective endocarditis has been asked as a short note, and then there has been an essay on infective endocarditis also being asked, automatically I know that infective endocarditis is a very important topic and I have to study this very thoroughly, because I can expect a short note and an essay from it. But otherwise, what might happen is I might read, or we'll say if I'm following some app lecture, you will go through infective endocarditis, but what might happen is it's only after you look at the selection book, I'd understand that, okay, this is such an important topic. So, but again, what I want to tell the viewers is you prepare according to your style, but these are the general inputs that we want to give you. Okay. Now, that's it for that question. And thanks, Leah and Shreya, for those comments. And now, see, final MBBS is very vast. Very, very vast. And this is what every student tells me. Current 2019 batch students, they constantly message me saying that the portions are vast. We have got postings going on. How to manage this syllabus? So, Dr. Krishna, can you please join us?
Yes, sir.
Yeah. Krishna, hello. You're from Kottayam Medical College, right?
Yes, I'm from Kottayam Medical College.
So Krishna is rank 1 from Kottayam Medical College. Krishna, this is my question for you, because how did you manage? It's such a vast syllabus. So what advice you want to give to your juniors?
Sir, first of all, as medical students, we are very much adjusted to this vast amount of syllabus. But coming to final year, we know that we have almost 5 major subjects, that is medicine, surgery, pediatrics, obs and gynae, and ortho. And apart from that, we also have some minor subjects. So what I want to convey, the most important thing is we have to start from the beginning of the year. Sometimes we tend to push things towards the end, and that's when we face the most difficulty. So what I want to stress is we have internal exams, we have short exams in our college. So if the advantage of these exams is that they always cover a much lesser units or portion as compared to the finals. So if we are devoting some amount of we are putting our maximum efforts to these exams, it's we can cover a large part, we can at least cover part of our syllabus. So so we tend to be busy in our postings, and we tend to ignore these internals or short exams, but we should not do that. So as we should at least prepare. For example, in our college, in our medicine internals, we used to split the topics. So we had like cardiovascular system or GI system. So that gives us more opportunity to learn them in detail. We not only prepare the essays, but also the short notes. So in that way, you can at that time make notes on that unit. So that leaves you time to focus on what you did not do at the end. So that is very important. I want to stress it very much. Apart from that, we have postings. So I tend to study those subjects in those particular postings. But my seniors also my professors also told us that we have to devote an ample amount of time to a theory. So what we tend to do is we devote our complete time to clinical postings, and then 2 weeks before our internals or any final exam, we tend to rush through. But that should not be the case. Instead, if we have at least an hour or so, we should denote to our theory exam. We should look up at the important topics and make notes. Make notes, because that is going to be very helpful, so that you can do multiple revisions towards the end with those notes and cover them very easily. And that is what you can do on the previous day, because going through the India textbook is in my opinion, it's not possible. Okay. And apart from that, we have certain subjects like obs and gynae and surgery, where we have clinical cases, for example, thyroid, breast, POVD, varicose veins. As we know, they cover a large part of our general surgery. So the theory paper also. So if you are preparing for those cases, we should have a thorough idea, like the practical point of view as well as the theory point of view. So that's going to help you to write your essays very thoroughly, because they usually, these sub questions are what we get in the same way as what we questions that they ask us during our practical exams. So what is your diagnosis? What investigations will you do? What treatment will you do? This is the same as what comes up in a theory paper. So that is going to be really helpful. So you cover a major part in that only. So you're left with some minor chapters in the starting. This applies the same for obs and gynae. So that is also another advice I have to give. And apart from that, the multiple revisions, as I said, are very important. So make sure that you have resources from the beginning. So what I'd like to say is that take those small steps from the beginning, so that towards the end you have an old thing in your hand and you can do it easily. It's really doable, because we all did it. So can you?
Okay. I think, some very important insights, and I think you have a very clear idea on, your strategy as well. And Krishna, one point I just want to emphasize once again, the same point that you told, is many a times when students go to their postings, they are in the clinics, they come back in the evening, take their time and then just go through what they learned in the wards without learning theory. They push theory towards the end. So what happens is you've got a lot of portions to cover. I completely agree with you. If you can just go through some theory part also initially, that would be easy. And as you rightly said about revisions also, that is going to help you. I think some very valid points, and thanks a lot for those insights, Krishna.
Thanks.
Okay. Right. So now, talking about revisions, one point that Dr. Krishna said was about multiple revisions. So let me just have Dr. Jagannatha. Dr. Jagannatha. Yeah. Can you please unmute? Yeah. Yeah. So good evening.
Good evening, sir.
Good evening. So you're from which college, Jagannatha?
I'm from SUT Medical College.
SUT Medical College. So just taking that question that I put to Krishna a bit more forward about revisions. How important are revisions, and what do you think? How did you manage revisions for your exams?
The revisions are as important as we studying for the first time. I would like to say that Dr. Krishna's point is very valid. Multiple revisions is the key. So my main method was taking each and every exam that I take very seriously, whether it is sessional, short exam, or any other in posting viva, whatever it is. When I'm studying, I studied properly, so that my first time read is proper, So if there is something like I want to prepare my own notes, I prepare it that time, so that it comes handy during the university examination. And then you first attend the first sessional, then you give a model, then you study during study leave for the third time, then again a rapid revision during exam time. That itself is a 4-time revision, which is a huge, you have a huge topic to cover, and 4-time revising each and every single topic is actually huge. Then revising each and every topic might not seem realistic. So what we have to do is revise much more important topics. So we have to segregate our topics into must learn and we should learn. Just learn, we must understand which is more important. For that, we should refer into our previous year question papers. So revising more important topics multiple times. And the key to the revision must be fast and frequent revision. Taking so much of time for revising is not actually going to help you. Same as the case, there will be different topics that is repeating in different subjects. Sometimes topics from medicine will be repeating in surgery. So when you're learning it from surgery and you have previously studied from medicine, you can just quickly go and take a look at from that medicine, so that you just keep in mind, okay, this is what I read in medicine. So you can correlate with surgery, and you can note down the differences. Okay, this is what surgery is emphasizing on this topic. So it's when you're studying the other subject also, you can revise the other topics you have learned. This is actually very useful.
Right. So once again, I want to emphasize the students, if you want to do multiple revisions, the only way is to start early and put enough time to your studies as well. Only then, as Dr. Krishna and as Dr. Jahannara said, you will be able to go through it multiple times. Otherwise, believe me, you will not get time to even read it once. Okay, so portions are vast. So please take your studies seriously and utilize your time properly. Now, so thanks a lot, Jahannara, for those inputs. And now, Dr. Badra, can you please join?
Yes,
Meanwhile, the viewers, can ask any doubts in the chat box. I'm sure that there will be more queries. So if anyone wants to ask questions, I can see a couple of questions. We'll be taking those questions as well. So we'll discuss that. But Badra, my question is this. Badra, short notes, essays. Now, how to properly write answers? Because I have seen many students telling me, sir, I prepared well. I prepared this topic well. I wrote it, but I'm not getting marks. So is there something about writing answers properly? Because you have got rank 1 and I suppose you're from Manjeri Medical College, right?
Yes, sir.
Yeah. So, so just tell us some tips on how to write good answers for your exams. First for your short notes and then for your theory. Yes.
Sir, am I audible?
Yes, you are very well audible. Yes.
Okay, sir. So hi all, regarding the presentation of answers in answer sheets, I think the way we present our answers is as important as the content that we write. So most of the points that I will be telling will be known to all of you, but I would like to emphasize them once again. So firstly, you have to divide your answers. In case of medicine, you can divide your answers into subheadings, like you can first write a definition, then etiology, pathophysiology, clinical features, investigations, treatment, and then you can write the prognosis. Other than that, you have to write with a legible handwriting. What I used to do was that I used to give a little more time towards writing the initial few questions. Because if you write the initial few questions with good handwriting and in a proper organized format, that will definitely create a good impression in the examiner's mind. Also, if you are quoting some sentences directly from any standard textbooks, you can underline that with a reading pen. Then don't leave any questions unattempted. I'll tell you one of my experience. During our medicine model exam, our final internal exam, there was a question where they asked about the classification of psoriatic arthritis. So I knew about psoriatic arthritis, but I didn't specifically know about the classification. So what I thought was, I don't know the classification, so I'll better leave that question. But later only I realized that many of my friends who wrote something about arthritis got some marks for that question. So what I want to tell you is that Don't leave any questions thinking that you don't know the specific answer to that question. But if you are having a broad idea about the topic, you should definitely attend that question. Also, if they are asking any specific questions, like in case of short notes, you have to before jumping to the answer proper, it is better if you can write some introductory points, for example, if they're asking the status of shock, you can first write the definition of shock. Then if you can mention the types of shock in brief if you want, then you can write the status of shock. This was a mistake that I did for a long time. I don't used to give any introduction, and I used to jump to the answer proper. But I think if you write in this way, that will fetch you more marks. And apart from the presentation, what I want to tell you is that you have to start early, because you cannot revise a vast syllabus just the day before your exam. On the day of exam, you will definitely have to rely upon your long-term knowledge that you have gained throughout these years, and also on your clinical posting. And also, if you try to cram things just 1 or 2 months before the exam, you may pass the exam. But the problem is that what you had studied, you will forget it very soon. So our ultimate aim is not just to pass exam, right? It is to gain knowledge. So I think cramming will not help us in achieving that. So start early, you have to study daily, and you will definitely get good results.
So one more question, Bhadra, I have. For the essay questions also, can you just give some inputs? Because short notes, you said, there has to be a proper structure. So rather, I also completely agree with this, because many students, the mistake that they make is for short notes, they write a paragraph. So the paragraph will contain almost everything, but no subheadings. So for an examiner who looks at that, the initial impression may not be good. But even if you do not know too much regarding the topic, if you just split it up and write it point-wise, I think it is going to fetch more marks. Some students feel that, when they write big paragraphs, that is what the examiner might like. But no, I think a better segregation, like what Dr. Bhadra said, would be the better idea. Bhadra, can you just comment about the essay part as well, how to write a proper essay as well?
Yes, writing essay is very important because they carry a lot of marks, and mostly we'll be writing it essay in the first, as generally the first question. So as essays will be divided into sub questions, you have to you'll have to allot proper time. You should not spend too much time on the essay or too less time. And as most of the essays are repeated, essays are not very difficult to answer. If you study the common essays, it will be very difficult to answer. And also another tip is that you can write it in a separate book. That is, which common essays you can segregate in one book, and you can write the answers to that. And on the day before exam, you can revise that. So you will not have any problem in writing the essays.
So, and Jadara, one point, Bhadra, I just want to add to that is, when you write essays, you've got to look at the marks. Suppose, one sub-question of the essay has 1 mark and the other sub-question has 3 marks. You should not write a long paragraph for that 1 mark question, even if you know so much about it, and then spend, some time for writing about 3 marks. So always when you have an essay, remember we had Khadija talking about how to write a diagnosis. So write the diagnosis, which is mostly going to be the first question. And the sub-questions, please look, what is the weightage, and answer accordingly, so that, you're likely to fetch more marks. Okay, right. So thanks a lot, Bhadra, for your inputs regarding that. Now, again, another question, again, emphasizing on the weightage of, or say, focusing on the vastness of final year. Many students ask me, sir, can I go for a selective reading, or should I go for every short note? So let me have Dr. Jayakrishnan. Jayakrishnan, in a panel which is dominated by females. I think you are here as the male representative of Kerala. So high hopes on you. Okay, so just tell us. Good evening. So Jayakrishnan, tell us, selective reading versus exhaustive reading. What was your strategy?
Sir, I would always say that smart work is much more better than hard work in some way, because time is always against us. the time is one factor that we should all consider while preparing for the final year exam. When we start determines how we read. So for selective reading or exhaustive reading, it depends upon how early we start. For example, if we have the time, we can have an exhausting reading in the beginning itself. But the problem is that I personally feel that exhaustive learning, it will like, I don't think we can't remember much of the facts that we will have, like what we need to actually remember. And everything depends upon how well we approach the subject. For example, if medicine, for in case of medicine, how I did was that I had an app to use. What I did was I read the textbook. In some topics, I found it. Some topics like CVS, some topics I found it difficult. So I used to watch a video to get my concepts clear. But I primarily use Davidson for my as my source, and I mainly emphasize on the boxes because I always thought that the boxes will give like what we read. It gives us a summary of what we are like what we read. So I think the boxes are very important, Davidson. They are usually asked as direct questions for the university exam. Last our university exam also had a direct question from Davidson box. Okay. And I guess that's like exhaustive reading. I'm not a very avid reader or something. My strategy was I looked at the previous year questions. I got like a pattern of what are the questions that I usually ask. Then I started preparing on it. Then we will find some topics that are usually important. And during our clinical postings also, our professors would say that these topics are important. Maybe they have not been asked for the exam, but they will tell that point is important or this topic is important. And so they will emphasize on that. And whenever a class is taken, in our college, I used to come and read what the topic is. I always think that the first reading is the best reading because first reading we should be completely thorough and we should be completely concentrated while reading it. We should not read for someone else. We should be completely concentrated, and because when we try to revise again, it will help us to more retain very easily. For some, there will be some difficult topics which will require multiple revisions or multiple readings, and that topics are the ones that we should mainly focus. I also have one thing. I felt my personal opinion was that final year is an amalgamation of first year, second year, and third year. Some topics will be present. So, for example, in case of medicine, they can ask a direct question like draw a diagram for the coronary circulation or draw a bronchopulmonary segment, which is purely an anatomy topic. So, how well be prepared in those 1, 2, 3 years, first year, second year, third year, depends. And sometimes the question may be directly asked and we may not have learned it. But if we have properly learned in our first year, etc., what are these bronchopulmonary segments, and if we can like imagine something, we can have an edge over the other students who have not properly prepared, like learned in the first year. And I always thought that medicine is pathology, pharmacology. It's an integration of that subjects. And there are some.
Just one point to interrupt, Jaykrishna. I think, it will be a good idea to look at the previous year questions also of these, topics.
Yes, sir.
Bronchopulmonary segments, drawing the circulation of Willis, coronary circulations. These are all previous year questions as well.
Yes, so, they are previous year questions. But I felt that most of the people will be focusing on the pure core of the medicine subjects. They usually don't, in my experience, I always thought that they usually ignore these small things. But I guess that if I am telling for a person who started their preparation in the middle or like little late, they may have some edge. I'm only telling, but I guess this can have some. It was a personal thing for me, because there was a direct question for me like that. I didn't prepare for my internal examination. There was a specific question like that, and I had some idea what the bronchopulmonary segments are, and then I attempted it, and I also got the marks, because I knew that these were the things that we should be like drawing, or what we should be answering. And
so I think, the main point that you want to emphasize here is about smart work. So you should have a focused approach rather than going totally haywire. I think some very, very important points. Now, again, the same question I just put to a couple of more candidates to see, their opinion as well. So Dr. Selda Jacob, can you please, and Jay Krishnan, you are from which college? Gokulam Medical College?
So I'm from Government Medical College,
GMC Ernakulam. Yeah, GMC Ernakulam. Right. And Selda Jacob, good evening.
Good evening, sir.
Selda, you're from which college?
GMC Palakkad.
GMC Palakkad. Fine. Selda, same question to you. Like, vast topics, what was your strategy regarding approach to the topics? Selective reading versus vast reading?
So when we talk about selective reading, many of us will be thinking about only the previous year question. So in my opinion, I think learning only the previous year question is not enough, because there can be some essays which could be newly asked. So if we did not read about that, we won't be able to write. So what I did was I tried to learn all the topics which could be possibly be asked as an essay from the selection book. And one advantage we have in is that if we read all the possible topics which could be asked for essays, there are more chances that we could get a short note from it. So it is a double advantage if we learn all the essay topics, and we will get answers to many short notes also. So what I did was I went through the selection book and learned all the topics which could be asked as essays. And about the short notes, it depends on how much time we have. So if we have more time, we could go through the selection topics and read about all the short notes also. And coming to short notes, the important thing is that to know something about every short notes rather than reading everything about some topics. So go through the selection books and read the topics you think will be important and go accordingly. That's it.
Okay, right. So again, almost same in lines of, Jay Krishnan, but I think, what she has said is you can expect questions out of previous year questions, even for the essays as well. So what she says is, yes, previous year questions, top priority, but you can have a few other surprises as well. Okay, right. Now, next, see, this is one question which many students ask me. Sir, when we go to clinical postings, we stand there, take case. Some of us take case, some of us do not. Many of us do not know how to properly utilize the clinical postings. So this is one question I want to put to Dr. Iman. Dr. Iman, are you there?
Yes, sir.
Yeah. So, yes, you are muted.
Am I audible now?
Yes, you are audible now.
Okay.
Iman,
good evening, sir.
Good evening. You're from GMC Kannur.
Yes, yes, I am.
You'll remember I took an orientation session for you and I had asked a question. You were one of the candidates who answered correctly, right?
As always, sir has excellent memory.
So, Iman, this is my question for you. How to properly make use of the clinical postings? Because many students tell me, I go there, I stand there for long hours. At the end of 3 or 4 hours, they take a what class. But just tell us how to best make use of final year postings, clinical postings.
Okay. If it's okay, I would like to share my screen, because just to organize my thoughts, I prepared some notes. Oh, I guess only the host can share
No,
this meeting.
Karthik, can you just enable Dr. Iman to share the screen? Just try now. Or let me just try. Wait. Change role to attending. Just 1 second.
Okay.
Okay. You can just start off. I just call the staff. Okay, you can just start.
I'll start. So I guess some of the main things I wanted to say is one of the most important things about this clinical posting is building confidence. It's highly underrated, in my opinion. Each day, when you approach clinical posting sincerely, you're building something that will be there with you during your practical exams. 100%. I guarantee that. It's like, for me personally, when I first started, I felt final year so vast. And even though I was studying every day, it felt like I wasn't using smart work. Like Dr. Jayakrishan said, I felt like I was studying haphazardly. And maybe some days I was just sitting or standing in the OP and understand 1-2 cases, but that's it. Or some days I felt like I only managed to get the history of this patient and I didn't complete an entire case. And I felt discouraged, especially in the beginning. But I always turn back to the analogy of like the ocean against a cliff face or like a mountain. Each day, the ocean is pushing against this rock. And even though in a single day, you don't see how much it's carved out of the rock, after the course of 1 year, it's definitely made a change. And so if you make every day count, it 100% matters. I personally, even the month, I only felt like I was writing proper notes the month before exam, even though I was writing notes from the beginning.
Iman, sorry to interrupt. Now I think you can share the screen. Now you can share.
Okay, let me try. Did I share my screen? No. Is my screen visible? Sir? Sir, is my screen visible? Hello?
Yes, your screen is visible now.
Okay.
Correct. Perfect.
Okay. Okay. Great. Thank you. So, number one, don't underestimate the importance of clinical posting. Every single day counts. Even if you're only learning a little bit, it will be there with you, and it does matter. Trust the process. And what I mean by trust the process is if you approach each day sincerely, it will show. And the most important thing is all of this will help you build confidence, because on the day of the exam, you need to feel relaxed. And you only do that if you feel like you have everything you need with you, all the information, all of the tools. And that comes from not only daily sincere work, but also doing it yourself. As Sir said, sometimes during clinical posting, you'll be in some unit of 4 students or 6 students, and then maybe one person might be doing everything sincerely. What I advise is try to do all of it yourself. Try to take cases yourself. Go forward, like don't hold yourself back, don't stand back. You ask the questions to the friendly faculties, try to find out which PGs are approachable and ask questions. Take as much of the case as you can by yourself. Take all of the findings and look for the findings by yourself. And because this all helps building confidence, which you'll notice I put as the number 1 objective. It also helps with cultivating a good image with the faculty, which is important in my opinion, I will say with experience. And coming to a point that many of the other doctors, panelists have emphasized, you have to learn something every day. Where during clinical posting, as Dr. Leah and Krishna said, you can read related to what you did that day. This helps you not only because the Viva questions will often be theory itself. You will come expecting they're going to ask a lot about practicals, but then sometimes the questions will be entirely theory for your Viva. So connecting what you've done that day with the theory will help with retaining the knowledge. And also you will cover the essays that way, because the essays are basically just diagnosis, investigations, management. Like roughly speaking, there's some more, but roughly speaking, almost all the essays follow this this format of diagnosis, investigations, management. So focus on that when you are going through your practicals. And many of the other panelists have mentioned multiple revisions. So I just want to speak from my own personal experience that in the beginning stage, I felt like I was not systematic. I was studying daily, but I felt I was not covering as much as I would like, and I felt unconfident. So try to approach, read sincerely in the beginning, and then the next time you approach that topic, go for a different approach. That's what I felt useful. Maybe if I read Davidson first, then the next time I approach that topic, I would either maybe skim through another textbook and then come back to Davidson, or just to see the headings in another textbook, or I would use a YouTube video because there's so many YouTube videos, or even any app if you own an app. And then especially with the long cases, teaching others, I think, is extremely important. Your final revision often comes when you just teach or you discuss with others. So you can make a habit of connecting long cases to essays by just discussing with your friends during the practicals. Then just to briefly skim through the individual subjects, clinical posting. With medicine, I felt just comparatively, there was a slight more emphasis on the method and reasoning and critical thinking. They want to see how good you are as a clinician, as how you can reach a diagnosis. So they want to see that you are doing things properly and that you know the meaning of the different heart sounds and what different variations means, how to properly auscultate, how to properly palpate. So go for Hutchinson to actually understand the correct method, and try to study in a way that you can show that you have critical thinking. Even if you get the result wrong, sometimes I feel that they look for the method more in medicine. This is in contrast to surgery, where in surgery I felt you're not asked so much about the method. Usually they only ask you to demonstrate a clinical skill only if they feel there's some discrepancy in the result. Because oftentimes the external examiners will be given a list of the cases. So they want to see the process through your presentation of the case. When you're presenting the case, they want to see that you know the order and you know the protocol, and you get that from ESTAS. And because in ESTAS, the ESTAS alone is not enough for surgery, in my opinion. Instead, the most important thing you're getting from ESTAS is the order of how to go through the examination and history taking in any surgery case. And they really emphasize the protocol. What I mean by that is you have to, it's so basic, but you have to check right and left side. You have to check the other systems. It's so easy to forget, but if you do that, it's also extremely easy to pass. You just need to show that you have that proper approach. And then, so it comes to the result in surgery, whereas in medicine, they will often ask you to demonstrate. And other points that I've written down for medicine, make notes. as many of the other panelists have said, try to get a class every day. Try to get a class every day from different faculty. That's what I want to say. Especially try to cover every system with different faculty. Try to get with 2 or 3 perspectives on cardiovascular system, 2 or 3 perspectives on respiratory system, so that you can cover all the different questions, because really medicine is such a vast subject that you will realize the things that the faculty emphasize is what they expect from a undergraduate student. Because truthfully speaking, even until my 60s, I will still be studying this medicine. Medicine is such a vast subject. So there's a certain amount that they are expecting from an undergraduate student, which is why you should focus on the things that your faculty advise. And like Dr. Jayakrishnan said, try to just skim through the first, second, third year when you're studying the some of the station related things in clinical posting. Sometimes your professors might have a class on x-rays or on drugs. So you use that time to go over the related first, second, third year. And with the OBGYN, I just want to give in my opinion, a pro tip. You practice with the fetal skull and the pelvis the way you did in anatomy. That is, do it group study and teach each other and hold the skull physically if you can, or at least mime with your hands, and look at it from different positions, different angles. Practice that, because it really helps. I'll ask you in a speed fire way, and so practice that from the base, And pediatrics, just what I've written, it's kind of like medicine in that the long case will be vast. It can be anything, but even though it can be vast like medicine, they don't emphasize your diagnosis in the long case. Instead, they emphasize mainly growth, development, nutrition, immunization, these 4 topics. So learn everything there is to know about that, and create notes for, when I say stations, I mean things like drugs, x-rays, specimens. Create those notes in a book and then keep them so for easy revision. And if you have any other questions, you can let me know, but I think I covered everything that I wanted to say.
Thanks a lot, Dr. Iman. I really appreciate that you have put in this effort as well, because that gave a very systematic approach, especially the way you compared how a medicine practical occurs with a surgery. And I think one point I just want to emphasize what you said. It's very important to get clinical discussions or clinical classes of multiple faculties. I'll tell you the reason why. Because in your exams as well, see, you do not know who's going to come as your examiner. And every faculty will have a different approach. Iman, when we were doing our final MBBS, what I used to do was, when we do combined study, we did combined study for the practical exams as well. So we had a group where each of us were posted in different units. So we'll be discussing together. So even though I am not in the other unit, so when we do a combined study like that, eventually we knew what is being taught in every unit. And more than that, we also got to know the approach of every faculty. So this is important because many students say that one faculty taught us how to do triceps jerk in this way, the other faculty demonstrates the other way. So to be very honest, the advantage of that mode of studying during my final MBBS was, when I went to the final MBBS practical exam, I was pretty confident that whoever be the examiner, I know the approach of that examiner, because I have read his notes, I know his approach. So that actually gives you a sense of confidence. So that is one point I want to emphasize again. Now, thanks a lot, Dr. Iman, for those inputs. Now, coming to Hannah. Hannah, are you there? Hannah? Hannah? Can you please unmute, Hannah? You're muted. Okay. Hannah is muted. Right. So I'll come to Dr. Siad.
Yes, sir.
Yeah, Hannah is there.
Yes, sir.
Hannah, I can't see your video. Can you?
There is net issues.
Okay, no problem. Hannah, anything you want to add apart from the points that has been said so far, or any point regarding this as well, which you want to emphasize?
I have the same opinion as my peers. We have to really put in some effort to score good marks, and it is not such an easy task. But if we give the effort, it will be worth it.
Right. So, Hannah, just tell us one thing. This is one question I want to ask you. In final year, many students find it very difficult to cope up with the stress. So how stressful was the last couple of months, Hannah, and how did you manage?
So we had a very positive environment in our institution. All our faculties were very supportive. So I think.
From which college, Hannah? Which college?
MOSC.
Okay, Collingery, right?
Yes, yes, sir. So that really made things a lot better, I guess.
Okay.
And but the studying phase was really difficult. We had to put in a lot of hours, but I think at the end it was worth it.
Okay, right. And I'll just go to Dr. Siad also with the same question, because in fact many students had messaged me before the session. How were the last few months? Siad, just tell us. How were the last few months?
Thank you for the opportunity first. Sir, is it audible?
Yes, you're audible.
So it's so stressful compared to other professional years, especially final year. Why? Because all the efforts that we took in for the last 4.5 years, plus the entrance 1 or 2 years for repeat and re-repeat, all this came into a conclusion in the final year. So right from the start of the model exams till the end of the last practical exam, it is very stressful. But one point I want to mention is that do not be panicked, especially to all my, I am telling this not to just toppers, I'm just telling this to ordinary students. Why? Because as you have mentioned in the classes of the final year topics, especially the medicine essay topic discussion, I still remember, if you got one essay question wrong, then nothing gonna happen. Because I also got an essay wrong in the final medicine theory exam. Nothing changed in my mark or nothing happened. If the coolness of the exam while writing the exams is lost, then we can't attend the exams properly. We can't think of the exams. We can't think of the answers, and we cannot present the paper very well. What as compared to digital examination, as I have talked to many of my professors said, it's very important to present the paper very much good and clean. So the paper presentation is also very much significant, and only the professors will judge you on the basis of what you have written. So to cope up with all this stress, I usually, if I feel very emotional or if I can't deal with the situation, I just take a rest for 15 or 30 minutes. And when my mind is clear, then only I start learning again. So what I have to tell to my junior batch students is, it is not how much time you have studied, it's what you have studied. And even if the shortest time you have studied, you can make it clear and make it able to reproduce when you are asked by someone else, especially the faculty or in the Viva session also. So prepare for smart work rather than hard work. One thing is completely sure that you can't study the medicine or surgery completely. It's not possible. So we have to learn from the previous year examination questions. We have to learn from our mistakes which we have occurred in the model exams and sessional exams. Then only clear it by mistake. Make mistakes and clear by it. Then only you can learn and learn to survive and be a good doctor or professional.
Okay, right. So you're from which college?
I'm from Gokulam Medical College, sir.
Gokulam Medical College. Okay, right. So thanks for those inputs. I think one very important point that you said is many students feel, Siad, once the essay is gone, you failed. Okay, I've seen many students messaging me, sir, I lost the essay, but I think I'll fail. Yes, some marks will go, But as he rightly said, if you are able to maintain your composure, don't worry, you will be able to compensate. So the problem mainly happens when the essay is gone, you have panicked, you end up making mistakes in the short notes of topics that you actually knew. So then the trouble actually happens. This is what I feel. Okay. So Ashwati, can you please unmute? Ashwati?
Yes, sir.
Yeah, Ashwati, you're from which college?
Sir, I'm from Jubilee Mission Medical College. Good evening, sir.
Yeah. So once again, congratulations and welcome. So Ashwati, the question for you is the same, he was mentioning about the importance of previous year questions. So just tell us about that, the importance of previous year questions and any more inputs that you want to add up as well.
Okay. So as far as the university exams are concerned, practicing previous year question papers is of utmost importance. That is before the exam. That is for any topic, that is be it medicine, surgery, gynecology, obstetrics and gynecology, pediatrics or orthopedics. You need to have a proper idea about the pattern of the question paper. And we should allot the time for writing each question accordingly. That is, in case of medicine, we have 2 long essays and about 20 short questions. And what I used to do was, before the day of the exam, I used to go to the question paper pattern, and I used to assess time. For one long essay, I used to give 30 minutes. For the second long essay, again 30 minutes. And for the rest of the 20 questions, 2 hours. That is what I used to do. That is, we need to divide the time properly and try to stick on to it as far as possible. This becomes more important when, if you're getting an essay that we know properly, you might end up writing it for long hours that we won't get time to complete the short questions. And I believe from my perspective, the short questions are more important in us fetching marks. For essay, even if, for essay, we'll get about 6, 7 or 8 marks. 8 marks. And I believe it is the short questions that helps in fetching more marks. So that's about the time limit. And then, as everybody have mentioned, while we're studying each and every topic, for example, if I'm taking nephrology in medicine, before starting each section, I should list down all those questions that have been asked before, and I should analyze the weightage of each and every topic. That is, if you're going through all the question papers, we'll know that in nephrology, the important questions are nephrotic syndrome, nephritic syndrome, AKI, and CKD. But if I'm going through Davidson for the first time without going through these question papers, all the topics will seem important for me, and I might end up reading the topics that are not so important for long hours, and I might not read the important topics properly. So we should have a proper idea about the weightage of each question and each topic. And so initially read all those topics that might come up as essays for our exam, and then read all the related topics. That's what I believe is more important. And even if you are going through the question papers, previous year question papers, never try to do selection among all those questions. That is, for our exam, as an essay, we had CLD. This was a question that had been asked many number of times previously. And another essay was APLA along with pieces of stroke and SLE. And that had been asked only once previously. So if we had taken more, if I had read only the CLD topic that had been asked many times before, and if I had not gone through this APLA question, I might have lost it. So what I'm saying is, never do selection within the previous year questions. That is, if you're going through the previous year questions, you have to read each and every one of it. Then, then in surgery and orthopedics, there's a clear distinction between paper 1 and paper 2. That is, in paper 1, only questions pertaining to this GIT and orthopedics will be asked, and in paper 2, only general surgery questions will be asked. But that is not the case with medicine. All the topics can be asked. There's no distinction between the first paper and the second paper. That is, we should know everything. So these are all the things that
this has been there for years. I do not know why they do it like this. Even during our time, also there is no such segregation. Every time I feel, there should be some segregation. At least tell the students. It's like, keeping them guessing what the essay is going to be with system. Okay, so I don't know why, what pleasure, sadistic pleasure we get, but since the time I did my MBBS, it was exactly the same, no change. Okay, so we also used to talk among ourselves, why they are not giving us a topic division. At least, you can focus, okay, paper one, these are the possible areas that I can expect questions from, right? So any other points, Ashwati?
No, sir. No,
Okay,
sir.
yeah, thanks a lot for those crisp, clear inputs. Now I just have Dr. Basil as well. Dr. Basil, so he's from MOSC Collingery. He is ranked 2 there, but I think, he is someone who is, very open to helping his juniors and a very talented kid, and who is doing some other works as well in addition to the academics pertaining to research. So someone whom I'm very proud of. So Basil, welcome.
Thank you, sir.
So Basil, what do you want to tell your juniors?
Sir, so now our juniors, that is the 2019 batch, has just entered the final year. And the question that I've been facing these days is, they've been asking me which textbooks to follow, like which textbooks for which subjects we are to refer. So what I would suggest is, we should not choose a textbook based on the opinion of someone who is a topper, or just because that book is being solved the most. I think it's we who should decide to choose which textbook we would get more comfortable with. So what I did was, I personally, during the first few days of my final year, I went to the library, and so we had options. Our HOD, he was, in case of medicine, he was very strict. He used to say that read only Davidson. And when I took opinion from my seniors, they also used to tell the boxes in Davidson are usually asked as 2-mark questions. So if you want to score really good, it's actually better to take Davidson. So I went to the library, and I had 3 options with me. One was Davidson, and other was Manipal's manual, Mandapa, commonly called as Mandapa, and the other one was Archit Bolu's textbook. So I took one topic. It was stroke, and I went through 3 of these textbooks. And what I got to know that is Davidson is more it's a bit vast, and it has all the information, especially the tables. And going through the previous papers, I later got to know that it's the tables, and sometimes even the diagrams are being asked as the 2-mark questions. One I would like to mention is there was a question regarding the natural history of hepatitis B, which was actually a diagram that is given in the Davidson. So to get more marks, I think it's better to refer Davidson. But definitely there was some starting trouble reading Davidson. So I began with Mandapa, and as one opinion that I took from my seniors was, if possible, complete reading Mandapa at least once. So it is not possible to cover the entire Davidson for this final year MBBS. So if possible, cover at least Mandapa. So what I did for medicine was, I took it in a 3-step manner. So during the first few months, I focused mainly on the essay questions from each main systems. So for that, what I did was, I found that in the Manipal's textbook, that is the Mandapa textbook, it is a bit more comprehensive, that we get to write a bit more bulky. The answers will be a bit more bulky with Mandapa. And in Davidson, the points are crisp, and some points in Davidson, for example, in the, I would like to mention in chronic liver disease. So for that, in that topic, when we are referring Mandapa, we have a whole lot of things written in that, but some specific points related to that, the things that we have to mention during investigations, some specific points, some grading scales, these are mentioned only in Davidson. And while writing these during our sessionals, I got to know that some value points that are being taken from Davidson carry some extra marks. I think the examiners get more impressed by those points. So my strategy was to keep these two books side by side and prepare my own notes. So in the first few months, I spent more time making notes. That was like actually combining the good points from both the textbooks. So what I tell my juniors now is to spend at least 1 or 2 weeks reading the different options that they have, going through all this, and then getting to know like which textbook or like also the format of the textbooks vary. So like which textbook they get more acquainted with to choose that. So I think they should definitely take more time in deciding the textbook, because once we get acquainted with the text, it's very difficult to change between. And the most important thing that I would like to highlight is prepare notes right from the beginning itself, because in the end, we won't be able to go through all these over and over for revisions. And for me, what helped me really is revision itself. So, and like till the last moment, just before the beginning of the exam, I kept on reading and reading. So like going through what I wrote. And for me, better than choosing a textbook, it's better to take points from all, write your own notes, so that it will be more easy for you to read even at the last minute and go through all these points. Same is the situation in case of all other subjects, like we have many options in surgery, pediatrics, and OBG also. So it's like, it's you who should decide which textbook you have to use or which textbook you are good with. But the thing is that always prefer the standard textbooks, because value points that we get from that is definitely going to fetch some extra marks.
Okay. So thanks a lot, Basil, for those inputs. And I think I have Jumana.
Hello, sir.
Yeah, Jumana. Jumana, what are your advices for your junior batch? You're from which college?
KMCT Medical College.
KMCT Medical College. So just tell us, what do you want to tell your junior batch?
So I would like to tell about how to approach a clinical posting in final year. So we all know that from third year onwards, we are starting our clinical posting. So by reaching the final year, we should be knowing something about the examination part of all the systems. Even if it is medicine or surgery, we should be knowing how to examine. So if we didn't know it, we can ask our PGs or interns to show how to examine. First of all, when you reach the final year, you should make a list of cases that will be asking in your exams, so that you can take all those cases during your clinical posting and make a note of it, so you can revise it during your exams. So if you are taking a COPD case, you should just learn how to examine the respiratory system in the previous day itself, and some theory about that topic. And the next day you can go to the ward and take the case. So it will be easy for you to take the case by knowing its theory and examination part. Or if you are finding any difficulty, you can ask your seniors or PGs from the ward. So it will be easy. You can approach every subject in this way, so that it will be easy for. Thank you.
Okay. So thanks a lot for that. And I think is there anyone who hasn't got the question? Just let me know. I think I've asked everyone. Yes, I think. Have I missed out on any candidate? Please let me know and please unmute. Rohita is there? Rohita? No. Right. So before I summarize, I think I would like to have inputs from, again, the panelists on anything that they probably missed out in the first round. So anything you want to tell, this is open to all the panelists. Any point that you want to convey to your junior batch. Anyone? Right. So let me just take the couple of queries. There is one question about pediatrics. Pediatrics takes too much of time. So anybody wants to answer that about pediatrics? Any particular tips for learning pediatrics?
Sir, may I?
Yeah, sure.
My video is not.
Yes, Iman, please.
Okay. I just want to say that for my pediatrics, I'm assuming, do you mean pediatrics studying takes too much time for theory, or do you mean taking a long case or taking a case in pediatrics takes too much
Maybe it
time?
must be about, it's
I try to
it's
answer.
basically a question in the chat box. They've asked about pediatrics takes too much of time. So maybe it must be with theory, to cover the theory topics, maybe.
I guess I'll answer both, sir, because for me personally, I remember the case felt like it was taking too much time because we had to do everything we do in medicine and also extra unique features that are specific to pediatrics. We had to assess their growth, their nutrition, their antenatal history. It was a combination of OBG and medicine and some unique features as well. So first I'll just roughly say with regards to practicals, for my practicals personally, there was a mix-up. They told me that one case was my long case, but then it turned out that case was actually my short case. And so I wrote my entire long case, and then they said, no, that's your short case, do something else. So I felt I didn't have enough time and I was so stressed. And then when presenting my case, my examiner actually asked me, why do you look so tense? And I said that I was short on time. I felt I wasn't able to cover everything as confidently as I would usually do because of this mix-up. And she said that don't stress here. We're testing your knowledge mainly. Even if you don't write the entire case sheet, you're not graded on the case sheet in pediatrics practicals. You're graded on your case presentation and your viva. The case sheet doesn't have specific marks. So practice doing everything. The more you practice, for during the exam, you have to do things reflexively, but don't stress about that. You will be able to do everything you need to. And as for covering everything for theory, as many of the other panelists said, use previous year questions. It's very important. If you utilize previous year questions, and mainly for pediatrics, especially OPGAI is almost everything, I think. Almost everyone agrees. So use the previous year questions and use smart work, use the OPGAI, write your own notes, and you will be able to cover everything that's important, I think.
All right. Thanks a lot for that. And so I'll also take this opportunity to, who's this?
Sir, Krishna?
Yes, Krishna, please.
Yes, may I add on the theory part of pediatrics?
Sure.
So I'd like to say that pediatrics has if you look at the question paper, it has a particular set. Like the first part is the essay, the second part is management of some important things that we study during the postings. The third part is usually the social part or the nutrition that we start, the initial part of pediatrics. So the second part, that's management, is like easily answerable if you have a if you have a workout, like if you work out early, like how to manage common things, and if you make a flow chart and present it in your answer paper, I think that's it gives you a lot of marks. So it's a good scores for that. So I think it's not to worry much about pediatrics paper. If you plan well according to and make a flow chart for all the common diseases, because it's usually repeated. For example, bronchial asthma, pneumonia, or even cardiac cases, it's going to be easier. And though I find OPGAI a great book, I would like to say that sometimes I did refer to IAP Pediatrics. They have beautiful flowcharts. So it explains things really well. If you want to understand the concepts, you can really go to IAP, have a good idea on that, and come back to OPGAI and make a note out of that. So that's it. Thank you.
Okay. So, and also last time we had conducted, I think, for a few subjects, the essay discussion classes. So we had conducted for medicine, we had conducted for pediatrics, and also for the practicals, we had conducted for medicine. Maybe a session for radiology was there. So like just wanted to know that those sessions were towards the end. So anybody wants to just explain on like how you utilize those essay discussion sessions? Because obviously the junior batch also will be having essay discussion sessions that will be conducted by DocTutorials. So anybody who has attended?
Sir,
yeah.
May I?
Yes, sure.
Sir, I had attended the essay discussion videos. Actually, towards the end, I got the opportunity. The link was only sent by that time. Actually, it was circulating, and we got it only by the end of the discussion, like almost CLD, TD, those discussions. But when I when I was revising, I read the answers from the beginning. So it was very useful because actually, truly speaking, the 4 essays I was able to attend only because I read the essay discussion, the proper orientation, how answers should be written, especially the investigation. It is like divided into general investigation, specific investigation. And then even for pediatrics, the proper way, like Sir discussed about meningitis, nephrotic syndrome, and all these important topics. So like in meningitis, how to differentiate between whether it is TB or whether it is pyogenic. These important points I got from essay discussion videos, and it was very useful. And even for short notes, I was able to utilize it. And myocardial infarction, Sir's note was very useful because at the last minute, I was able to revise through that. So it was very helpful, and I advise all the juniors to watch it because it's not at all a waste of time, because that is very, very useful. I mean, very, very important and very, very useful. So after watching those videos and utilizing those PDFs, we can go and revise from our textbook. That is very useful. Thank you, sir.
Anyone else on how you utilize those essay discussion sessions?
Sir, may I? So first, when we have arranged these essay discussion topics, I feel doubt to whether to attend the session in the last minute or not. But honestly, believe me, sir, you are the reason why we could attend or why we could write a essay topic that is a cortical venous sinus thrombosis. That is one of our essays. So majority of the students, usually if we tell our juniors to read Davidson and not to read Mandapa, a majority of the students in many medical colleges is still reading Mandapa as the first primary source of the textbook. And that essay was not in that textbook. And many of the colleagues after the exam had mentioned, told me that they could only attend that question because of which what you have taught them. So it's a great blessing for us to have those sessions. And I honestly ask my juniors to attend that session too. Also, coming into the practical aspect, when you have taught the basics regarding the particular lobes of the brain and what are the symptoms and signs which will affect if there is a lesion in the temporal lobe and occipital lobe. First, I feel whether it is up to our level or it is somewhat higher level. But when I sit in front of the examiner and they ask me the same question, I was shocked. But I could able to reproduce many of the answers which you have taught me. So thank you so much for that. I honestly want to appreciate all the efforts you have put forward for this. And I will also tell my juniors to follow that way also. So thank you, sir.
Thank you so much. So this time also for the junior batch, we'll be conducting multiple such essay discussion sessions. So I hope the viewers have already joined the WhatsApp groups that we are having for the 2019 KUHS batch. If you have not, please text me. My WhatsApp number is 9447 334944. So you can WhatsApp me. So basically, if I just summarize what has happened in the due course of this discussion, I'll just tell you my insights just to summarize the whole discussion. Number one, regarding theory. Okay, this is just, we have heard the views of the toppers. So these are my personal views as well as summarizing the views of the toppers. So First of all, regarding the theory part. Theory part, my suggestion is, since the portions are vast and time is limited, first, for each system, for example, cardiology, you make sure that the previous year topics, they are covered first. Yes, you might get questions out of that as well, but the probability of getting question is maximum with the previous year questions. So I would look at those topics and the essays and cover those topics first. Secondly, I strongly believe that you can do a PG medical entrance preparation along with this, because once you finish cardiology as a system, I feel you should go through the MCQs of cardiology. Okay, because many students think, okay, learning for entrance is some other way of preparing, but why not go through at least the MCQs of cardiology? Once you're done with cardiology, you will be able to do it, provided you are putting enough time to your studies. So theory, you do the previous year questions and then the other questions if time permits. And one point regarding the textbooks, because we see that toppers are also having different views of the textbook. I'll tell you my suggestion. If you are following any app and say, for example, medicine, if you are following my lectures, I would say, first of all, when I take a lecture on myocardial infarction, so whatever I am taking will have points from Harrison, Davidson, and also including the latest guidelines, but I've tried to present in a very simplified manner. So I would suggest me or any other faculty whom you are following, first look at the previous year questions, then follow those but from the lecture part. And once you're done with that, suppose you feel that there are a couple of short notes which are not there in the lectures. Say, for example, they're not very important for entrance, but they're important for theory. That part you go to the textbook. Problem often happens when you learn a myocardial infarction from a faculty, then you go to a textbook. Suppose the resource that you are learning from has got points from the standard textbook. I don't think there is a need for duplicating the stuff. The examiners are not going to look as if you have written lines from Davidson or something like that. You should have a clinical sense to answer properly, yes, but I think you can definitely rely on a resource if you feel it is authentic, instead of duplicating, reading stroke from the app and also from the textbook. If it is authentic, that is very important. Okay, I always make a mention of this: medicine to be learned from a clinician. Many a times, when you learn a particular topic, you might not be learning the actual fact. So you should be learning medicine from a clinician, surgery from a practicing surgeon, so that you are updated. That is very important. Medicine, everything keeps changing. So you cannot follow notes of many, many years back. That's not the way to do it. So many students, somebody said Davidson, somebody said some other textbook. My suggestion is, you go with something that you're comfortable with. If you're confident on the app, just go with that. And if there is any other question which is not covered in the app, go for the textbook. That is enough. Don't think that you have to read the textbook itself, provided the resource is authentic. Okay. Now, very important to revise it multiple times. That is also a very important point from this discussion, because otherwise you're finding it difficult to memorize. Then for the short notes, I think some very important points that the toppers have said is to structure the short note properly into introduction, the definition, etiology, clinical features, investigations, diagnosis. And also for the essays, I think, we had a discussion on how to write. Khadija was telling about how to write a proper diagnosis. And also the other toppers were telling about how to split the answers of the essays very well and to present very well. And I think, I think Bhadra was also saying about this point that, you should make sure the first few answers are presented pretty decently well. Decently means it's not like they should be the lengthiest answers, but they should be presented well so that the examiner has a good impression of yourself. And also it's important to do for practicals. I think, a bit of combined study might help, especially to know the approaches of faculties from different units. And we also emphasize the importance of being thorough with the history taking and the examination format, so that you are able to perform well in the practical exam. And yeah, these are the points I think we have stressed upon. And let me just have a quick check if I missed out on any other point. Answer writing we have done. yeah, the importance of selective reading. I said you can go for smart work, but again, it depends on the time that you have in hand. Previous year questions, revisions, essay diagnosis, yeah, writing a case sheet effectively. So I think we have covered most of the points, and we have taken the questions as well in the chat box. So can I have everyone on screen just unmute as well as show your video? Just appear on the screen once again. Okay. So just for the junior batch, we have a show of thumbs up to the junior batch, wishing them all the best for this stressful phase. But I think, which can be made enjoyable if you learn well. And so just let's show all a big thumbs up to our junior batch students, and thumbs up to
all the best.
All the best.
Thank you everyone for joining. And I think, at least some of you have started your internship, some of you are about to start. So happy that you all came forward to help your junior batches. I'm sure that this is a party time you must be enjoying. At least some of you would have started internship as well. So thanks a lot everyone for joining us, and looking forward to teaching you more as well in future. And thanks a lot everyone for joining. All the best to my junior batch students. Thank you so much.
Thank you, sir.
Thank you, sir.
Thank you, sir.